Good afternoon and welcome to Research in Action, brought to you by the Division of Research at Florida Atlantic University. My name is Karen Scapinato. I will be today's moderator. And before we get started, just a few logistics. You may have noticed all these pretty pictures in our pre-show. Those are all submissions for our Arts of Science exhibit that is now open in the Dorothy F. Schmidt Performing Arts Center here at Florida Atlantic. So if you want to see these images in person, please come over and view them. Okay, welcome to today's webinar. If you're a regular here, you may notice that we had taken a brief break in our Research in Action webinar series, but we're back now a little bit at a different time this time. So I'm hoping that we were able to accommodate everybody. If not, this webinar will be recorded and will be available on our website later. So look for Research in Action at FAU. With that, welcome. For those of you who would like to ask questions, we more than certainly want to answer your questions for today's talk. You would have to type your questions in the Q&A box. If you look in the bottom of your screen, you see a little icon that says Q&A. If you click on that, a little pop-up comes up. You can type your questions there anytime during today's presentation. We will get to the questions at the end of the presentation. If we should run out of time, our presenter has agreed that she will be able to answer any remaining questions offline, and then we'll post the answers on our website. With that, it is my great pleasure to introduce today's speaker. Maryellen Quinn-Lunny has a Bachelor's of Science in Elementary Education, a master's degree in moderate special needs and education specialist degree in learning disabilities, and a Ph.D. in educational leadership and research methodology with a concentration in adult education. She has worked as a special educator in Massachusetts, overseas, and for both Palm Beach and Martin school districts. She has worked in the field of special education for 44 years, as an exceptional student education teacher at the elementary, middle, and high school levels, as well as for the past 27 years as an administrator in special education. Maryellen has served as a director of the FAU Center for Autism and Related Disabilities since October 2011. You can tell that she is truly an expert in the field, and with that, I welcome her to tell her story and her research.
Thank you, Karen, and thank you, Janelle, for this opportunity. And thank you to the Division of Research for this opportunity to be able to share my research. So some of the topics that I'll be talking about today are challenges of raising a child with autism spectrum disorder, the benefits of early identification. My research focuses on disproportionality and specifically disproportionality of Black children in autism. I'm going to talk about the research in early identification and misidentification of Black children with autism, and then provide some resources that we have developed at FAU to be able to address that problem. So before we get started, just to make sure that we're all on the same page, the definition of autism, it's a developmental disorder, a disorder manifesting in young childhood with deficits in social communication, social interaction, and presence of restricted, repetitive patterns of behavior, interests, or activities that tend to persist across the age spans. And that's the CDC. Autism is a spectrum disorder, so it manifests across levels of severity, and we divide it into 3 different areas: mild, level 1, which requires support; moderate, level 2, which requires substantial support; and then severe, level 3, requiring very substantial support. The prevalence of autism: 1 in 44 children in the U.S. is diagnosed with autism. And autism is characterized, as I mentioned earlier, across a spectrum, varying in symptom, presentation, and severity. It's not thought to differ across race, but what you'll see and what my research and what the research shares is that the prevalence differs across racial groups, and we'll talk about that today. Symptoms of the disorder may vary significantly depending on the age and the developmental level of the child or individual. Autism can be reliably diagnosed by 2 years of age, but what we see in the United States that typically it's not identified till about 4 years of age. Some of the causes of autism are likely to be varied. There's no known biomarkers. By that, I mean, there's no blood test, there's no tissue test that can be done in order to identify autism. So autism diagnosis relies on a detailed history, professional observation, in structured and unstructured situations, parent report of child behaviors. And autism is thought to be a combination of hereditary, environmental factors, and brain functioning. Some of the barriers, and there are barriers, and my research will talk about some of those barriers to early identification of autism. We know that for a variety of reasons, we're seeing medical professionals not identifying or not referring children for screenings. The American Academy of Pediatrics guidelines support universal screening for children at 18 months and 24 months for autism, and at any age when the parents express concerns. And part of my research and several other of the studies that have been conducted at FAU CARD supports that. All children should be screened by 2 years old, and those identified at risk should promptly receive a comprehensive evaluation. And I shared, for a variety of reasons, such as inability to identify the characteristics, we saw that in our study, and lack of medical professional training, many children are not screened for autism, and wait times for diagnostic assessments are lengthy. Some of the barriers to early identification, what parents, and in this study also expressed, that parents express concern. They see the difference between their child with a delay and their other children, and they express that concern to the pediatricians. Primary healthcare professionals play a critical role with the wellness visits, and also in our study, my study, we saw that parents brought this concern at their wellness visits, but they weren't always validated. And that uninformed clinicians are a source of frustration, often complicate the family's ability to obtain quality services. The benefits of early identification are numerous. Early diagnosis of autism is critical to ensuring that children receive early access. Without early identification, they won't have early access to evidence-based intervention. Beginning intervention early can greatly improve the outcomes for children at risk and across the lifespan. Early identification and treatment lead to better cognitive and language abilities. There's numerous studies that support that. And then young children with ASD who receive early behavioral intervention demonstrate substantial gains in functioning. Other benefits are parent involvement. Autism impacts not only the child, but impacts the entire family. And parent involvement is critical for positive child outcomes. The parents need to feel competent and empowered that they're able to work with their child. Effective early intervention can greatly decrease the costs over the lifespan. Supporting a child with autism is very, very costly, and early intervention can support that. Parent-implemented treatments promote the use of effective evidence-based interventions, engage parents in the use of early effective intervention. So getting parents involved in the intervention process is found to be extremely successful. And then parent-implemented early intervention increases parents' feelings of competence and empowerment. And this is really important for parents to be able to work through this process over the lifespan for their children. Some of the challenges of raising a child is parenting a child with autism has been identified as more stressful than parenting a child without autism. There are lots of studies, numerous studies that talk about, support the fact that raising a child with autism is extremely stressful, creates high levels of stress in parents, depression, anxiety, and anger. And the other piece to consider is 85% of persons with autism have needs requiring parental care and support across the lifespan. Many parents care for their adult children across the lifespan. Some of the other challenges of raising a child with autism are difficulty in securing identification, and that was found in my research study and other research studies that were completed at FAU CARD. Dealing with problematic behavior is extremely challenging for parents. Having meltdowns in public often impact parents, and they do not tend to bring their child out in the community. Costs for care, not only the medical kinds of things, gastrointestinal kinds of things, other things that medical concerns that tend to pair with autism, but also the cost of therapies are extremely expensive. Restricted access to childcare and community activities. Many of the ratios, the teacher or the adult child ratios are not within the means to be able to support children with autism. So that often is a barrier for children with autism and their families to access childcare and community activities. Barriers to accessing education. Ability to access applied behavior analysis, speech and language therapy, occupational therapy, physical therapy, all of those things that are important for their child. There are many barriers. Many don't take insurance, many don't take Medicaid, and so that can be problematic. Time, that is on behalf of the parent in obtaining and providing treatment for their child. Uninformed clinicians, that was something that came out of my research study, but is also in the literature, that pediatricians that are not knowledgeable about autism and won't validate the parents' concerns when they express their concerns. And then intensive efforts to ensure appropriate interventions. Parents have to fight through that process to be able to access those services and supports for their children, and it's challenging. So today, what I'm going to be speaking about is not only the challenges, but also what is disproportionality. This is something that I've studied for a while. And we know that autism is not thought to differ across race, but prevalence differs across racial groups. We know that girls continue to be lower, identified at a lower rate than boys in autism. We know that Hispanic children are diagnosed later and receive fewer services than their white counterparts. And Black and Hispanic children are identified at a lower rate than white children. So we know that there's disproportionality in the field. So what I'm going to speak to specifically today is the disproportionality of Black children and autism. We were very fortunate. I did my research for my dissertation, and we were very fortunate to secure several grants from the Taft Foundation to be able to study this, and also other research projects as well. But Black children are identified later than white children. We know that that's problematic, especially with the importance of early identification. We often see Black children are more likely to have co-occurring diagnosis. So what that's telling us is that Black children that have intellectual disabilities are being identified, but maybe the higher functioning children, the level 1 children, are not being identified. Black children are often misdiagnosed more than white children. What we've seen in other research is that Black children may be identified with having an intellectual disability, but not autism. So the interventions are not necessarily appropriate for them and help them. And Black and white parents raise concerns to healthcare providers at similar ages, but we're still seeing where the Black families are not validated. Black parents do not receive the same level of participation and partnership with educators as white parents. And I'll share with you in my research some of the statements that parents made. And there exist differences in available services and access to services for Black children. And finally, Black parents do not always feel that healthcare providers demonstrated respect toward them and their child, mainly validating their concerns about their child. So my research was a qualitative research study. It was phenomenological in nature. And the primary question I asked is, what are the lived experiences of Black parents and guardians through the ASD identification process? And really to try to understand, why does this problem occur? And what can we do at FAU CARD to be able to help? The significance of this study, I believe, were the lived voices and experiences that parents shared that really help us to better understand the problem. Understanding obviously will contribute to the body of knowledge and inform the literature and assist in remediating the problem. And the firsthand experiences inform practitioners, practices, and policies so that we can be able to better assist and support families. And then also, which is important, is that the identification of barriers and facilitators that helps us as educators to be able to better identify and to support families. So my study focused on, it was a qualitative study. I had 3 pieces of data that I collected. I interviewed 15 families, 16 participants across a 3-county region. Out of those participants, 10 were identified or supported by CARD, but were registered with the Center for Autism and Related Disabilities, and 5 were not. What was interesting was that across these 15 families, there were 19 children. You can see there were 4 families that had multiple children with autism. The other piece that I looked at is their marital status, whether they were married or single, because of the divorce rate and the high rate of among autism. But only 2 of my families were single. All of the others were intact families. And you can see here the ages of the children at the time of the study with autism. So it really varied. And you can see here, out of the 19 children, only 2 females were identified. And that kind of shows the disproportionality in females. I used 3 sources of data collection. I did a semi-structured one-on-one interview via Zoom. It was during COVID. I did a follow-up parent questionnaire and a follow-up parent journal article or journal activity that helped them kind of reflect upon the process and their experience. And you can see from here, all 15 of the 15 families completed the interviews. 11 out of the 15 completed the parent questionnaire, and 11 out of the 15 completed the parent journal article or the parent journal activity. Through, a qualitative research project, I color-coded the themes and identified the significant statements and color-coded them. The statements were identified, categorized, and correlated with a secondary coder. So I used a secondary coder that worked with FAU CARD that happened to be Black. And then meaning units were identified, grouped, and correlated with the secondary coder. And then textual, structural, and composite descriptions of the phenomenon were identified. And I did 4 cycles of coding were utilized. So the phenomenon that I identified is that, and it's supported in the literature, is that parents have to fight. I call these parents the unrelenting fighter, that Black parents have to fight, they have to advocate, and they have to persevere in meeting the needs of their children with autism. And these were some of the really important statements I felt that reflected that phenomenon. I have to fight more for him because he has autism. Parents need to advocate for their children with autism. It's important to stand up for yourself, especially as a Black parent, and to push back against biases you are encountering by pointing them out. You have to have a level of fight in order to do what is needed to get your children the services. Be persistent. You have to be, it's for your child. And so everything you literally have to do is fight for. So you can see that theme of fighting and constantly having to advocate and persevere. And this was really through the lifespan that parents were sharing this, not only through the identification and securing of treatment. So there were 5 themes that I identified. Theme number 1, allies are sought and created to support Black parents in securing ASD identification and treatment for their child. Theme 2, numerous challenges are faced by Black parents in seeking ASD identification and treatment for their child. Theme 3, Black parents experience different, and I'll share with you some of the statements that the Black parent shared with me in seeking identification and treatment. Black parents often feel isolated in raising their child with autism. And then finally, faith in God helps Black parents positively reframe their experience in raising their child with autism. So theme 1, allies are sought and created to support Black parents in securing ASD identification and treatment for their child. These are the statements from the parents. Find support groups or other mothers that culturally understand what you are going through, because these mothers can provide you insight. Seek out support groups, get an IEP advocate. I find it helpful for parents to have a mediator like FAU CARD. Always seek a second opinion. If you can try to find a Black provider, I think if they look like you, you may get more information. And when I linked up with other parents, there was something powerful about that. So that concept of having someone that's gone before you that can come alongside you and be an ally in this process through identification and securing treatment. It could be another parent, it could be another professional. And what this had really prompted us at FAU CARD is to really set up some support groups for Black parents. The second theme was numerous challenges are faced by Black parents in seeking ASD identification and treatment for their child. The principal of the school was not helpful at all, and they said they could not accommodate her. At the time, I did not know. Many times we hear about situations where parents are called to pick up their children, and they have a right to be there, and the school has an obligation to educate their child. We applied for ABA therapy, and because the caseloads are so full, you end up waiting on a waiting list for God knows how long. So a parent trying to seek therapy in the community, and very few provide accept insurance, very few accept Medicaid, and it's very, very costly for these services. The pediatrician did not pick up autism with either of my kids. And that was a theme that went through, is that despite the wellness visits that parents took their children to, many of the children were not identified early. They were identified and the parents had to push to seek a referral for evaluation. A lot of people think you have to be nonverbal, throwing tantrums and flapping constantly to be identified with autism. To me, this shows that people understand how autism may manifest stereotypically, but they don't see maybe those children that are level 1 children and level 2 that are milder. And that was really supported in my research as well. And there appears to be a disconnect between the perception of resources and the existence of resources. In the end, we paid out of pocket for everything, a huge financial burden. And that was shared multiple times by parents, that concern. Theme 3, Black parents experience different treatments in seeking ASD identification and treatment for their child. I was not listened to from the very beginning, that concept that parents are not validated, they're not listened to. They know that there's something wrong with their child, there's something different about this child, but no one is helping them. No one's validating their concerns. I found my experiences minimized. Their speech, talking to white families, is different than talking to Black families. I'm not a racist, but I do believe professionals have biases. I don't think they know they have biases. So that observation in the pediatric office or in the school front office where they feel that they're getting different treatment because of how the white parent is treated versus the Black parent. I've learned that people of color do not get the same treatment when it comes to healthcare and navigating the school system with IEPs. And I think this is something, as an educator, all of us need to be aware of. And believe us, give us the same benefits of a doubt you give Caucasian parents. The fourth theme I identified were Black parents often feel isolated raising their child with autism. I stopped attending the church because everything stops and they are waiting for me to get this child under control. And I see the eyes and I don't want to place people in an uncomfortable position. And I refuse to apologize for my son. This is him. If you want me, you want all of me. That concept that my child is not being accepted in various environments in the community, whether it's in a faith-based environment, whether it's in various community activities. My family lives far away. We do not visit them as much as we normally would because of the logistics of traveling with a son with autism. This family shared about how they couldn't go and take vacations or travel as a family. One parent had to stay home with their child with autism because it was so challenging for that child to travel. Some family members help us, others stay clear of us. And I think that's another factor that I saw in my research that's also substantiated in the research, is that family members aren't always supportive. They don't understand. So that's a part of what we try to do at CARD, is to educate all the family members. I was so devastated when my son was identified and cried for days. I felt ashamed. I thought about what everyone would think. I was overwhelmed. And that's something we hear from families all the time, is that, you know, this whole process is so overwhelming. Their child's behavior is so overwhelming. They feel like they don't get the supports that they need. And it's a very challenging journey. She goes to predominantly a white school, and I have no problem with that. But as much as I have a connection, I feel like I have a missing connection. And this parent not only feels isolated in two, her child is Black, but her child is also female. And what we do see is underrepresentation of females in autism and underrepresentation specifically of Black females in autism. And the final theme was that was really a facilitator. Faith in God helps Black parents positively reframe their experience in raising their child with autism. I believe in God. I believe God will send angels in your path to help you through this journey, talking about other people that will come along that will support through this process. I already had faith in religion, but I'm like, God, I give it all to you. I honestly did not want to deal with any of it, but this little boy is looking to me right now. So that concern that I'm here and it's all on me, and I'm here to try to support my child and fight for what is needed. My relationship with God has helped me to be a good mother. So that whole idea of faith in God helping facilitate. When you accept God is in control and has a good plan for your child, you do the best for your child. And this final one really touched me. There are things that the faith community can learn from these children about faith, forgiveness, and love. Nothing bothers my son. He lives and forgives quickly. And that is a characteristic that I see, that vulnerability and that unconditional kind of acceptance from people with autism. So out of these areas, these themes, I identified facilitators to identification. Black parents fight, they advocate, and they persevere in meeting the needs of their children with autism. They seek allies. Allies are sought and created to support Black parents in securing ASD identification treatment. Those allies were sometimes professionals that helped come alongside them. They were parents that came alongside them and helped them through this process. And that faith in God helps Black parents positively reframe their experience in parenting their child with autism. Some of the barriers that we've talked about there are numerous challenges that Black parents deal with in seeking identification and treatment for their child. Unequal treatment, educators and healthcare professionals that are not knowledgeable about autism and how it manifests across the spectrum, not having that support in place, the costs, all of those things that we had identified. So one of the things in working with FAU CARD, we try to take this research and try to utilize it to develop tools and supports for parents. So this research and another research study that we did through the Taft Foundation, and also there are two other research studies that are just completed through the Florida Developmental Disabilities Council, really create awareness about the problem of underrepresentation of Blacks in autism, delayed identification and misidentification of Black children. So really bringing that out, we formed a community task force, and that task force meets on a monthly basis, and we provide training to them and create awareness and understanding about how we can come alongside parents to support them. How can we educate pediatricians? How can we educate early childhood providers and others to be able to support families through this, this process of identification and seeking treatment? We've created trainings and educate parents about autism, because that was the other thing, is that parents need to understand autism, what are the red flags, and be able to help their children. So we developed a training called Little Owls that really is an orientation to the world of autism. And then we also developed another training called Building Better Behavior, or RUBY, Research Units and Behavior Intervention, that helps support parents and teaches them how to work with their child and develop behavioral supports. We started a Black parent support group that meets online, where parents, there's a training that's provided, but additionally, parents have an opportunity to talk about their concerns and support. One of the other areas that we're looking at now is developing a parent mentor program. And this research and other research projects influence that. And we're looking at parents that are further along in the journey that can come alongside to support parents, younger parents with younger children that are just starting this journey. We gathered and developed resources identifying Black community professionals. Parents shared with us that they would like to bring their child to a Black pediatrician or other resources. So we're in the process of gathering that for families. And we developed some tools to educate pediatricians and early childhood providers in understanding autism and sharing with them if they don't feel comfortable in doing developmental assessments, that we can come by and do those screenings for them. So these are some of the tools. We started a parent support group for parents. They meet on Wednesdays. Chandra McKinney-Clark is the outreach specialist that coordinates that. We surveyed the parents this past summer, and they are based upon the survey. There is a training component every month as a part of that training. I mentioned we developed a training called Little Owls that was from a grant through the Taft Foundation. And Little Owls, there are 12 different components. It's in English, Spanish, Haitian Creole, and Portuguese to be able to support families. It talks about the difference between diagnosis and eligibility in the school district. It talks about what's an IEP, how to keep your child safe from wandering and elopement, all of those kinds of things. So, and the parents go through this training and they really develop a community through that. So there's the flyer there. We also had screened parents or surveyed parents to identify how successful they were in obtaining applied behavior analysis for their child. And because the schools provide support and behavioral support, but often children with autism need more. And so we identified a program called Building Better Behavior. It's free to our parents. All of our services are free. It's based on the research from the Ruby program, Research Units in Behavioral Intervention, and it really helps parents. It's implemented by a licensed clinical social worker and a licensed BCBA, board certified behavior analyst, and it involves trainings and then also coaching and support to the parent. This is our flyer for our community task force. Any of you are welcome to come to the community task force. It meets once a month. There is an opportunity to create awareness about the problem, how to work together as a community. We have educators, parents, a lot of agency support. And we also, Chandra provides a training every month as a part of that. This is a packet that we had developed through FAU Card, and it identifies, we have challenging times trying to get pediatricians to come to training. And so what we had done is develop this packet. It's on our website. I included the link there. The pediatrician packet we collaborated with 211 Help Me Grow, and they provided the packet to all the pediatricians that are connected with the Help Me Grow program in Palm Beach and the Treasure Coast. And then from there, we are identifying those pediatricians that are not a part of that subset and sharing this information with them. And it's packed full of information for pediatricians, sharing what are the red flags with autism, what are resources for them, what are some other supports that are there, and training as well. And then we also developed a guide for early childhood providers. Excuse me. The providers, what we found is that they are critical in identifying children that are maybe not meeting those developmental milestones. This guide assists them in helping them identify what the red flags are, how to talk with parents about it, what are resources to get children identified and evaluated. And this also is free. It's on our website, and here's the link to it. We're presently working with all of the early learning coalitions and all of the early providers and daycare centers to make sure they have this information in Palm Beach and the Treasure Coast. These are just some of the resources or references, and then my contact information. And I'm happy to entertain any questions. And if we don't have time, feel free to email me. My email is right there, mqlunny@fau.edu. I also included our website. There's lots of resources on there. FAU Center for Autism is a grant. We're funded through the Florida legislature and administered through the Florida Department of Education. And we provide, all of our resources are free to parents, educators, and community members. And thank you.
Great, thank you, Maryellen. Very interesting and a lot of resources, as you can tell. So if you didn't get all of the links and all of the information, we are recording this presentation, and it will be available in a couple of days or so on our website. If you just Google FAU Research in Action, it should come up. If for whatever reason you don't see it, feel free to contact us. And just as a reminder, if you have any question for today's speaker, please use the Q&A button in the bottom of your screen. You can type your question there. We're going to go through them as they come in. Maryellen, the first question that came in earlier, private schools often turn away spectrum kids, and it's left to the public schools to absorb the costs, even though they don't have the funds. Do you have any suggestions how to navigate that?
Well, we work with all of the private schools, the charter schools, and also the public schools. The responsibility for child find and educating children with disabilities is with the school district. And so really it's up to parents to identify the best option for their child. Excuse me. And we work with parents in whatever. There are many children with autism that are in private schools, that are in charter schools. And it's something that the parents really are best, and we support wherever. We're able to come in and do observations of children, provide resources. We provide lots of training. We provided over 300 trainings last year to educators and community members.
Great. You mentioned early on that the wait time to get an assessment of your child is really long. Is there anything that you can recommend that a parent can do if they see that there are certain indicators that the child might be on the spectrum?
We can certainly do a free screening at FAU Card. Pediatricians, I would, if you suspect your child has autism, and during the wellness visits, I would insist that the pediatrician does a developmental screening and refers either to a pediatric neurologist, a clinical psychologist, someone that's knowledgeable about autism. We certainly have resources on our website. We have a directory of providers, and we can certainly help parents navigate through that process. Parents have to be persistent, and that's some of the research that's not only in the literature, but what I found and actually in all of our studies was that there is a hesitancy not to evaluate children. And so even just to rule out autism, sometimes, a pediatrician will give you that referral if you say, I just want autism to be ruled out.
Mm-hmm. What is that hesitancy based on? Why is that? Why does that exist?
I think that there's a thought that maybe autism is over-identified, but when we looked at 1 in 44 across, and we looked at our census, and we looked at across our 5-county region and across the state, we don't see that to be proven true. So I think there's maybe a bias to that. Pediatricians feel that there are too many children that are identified with autism, and that parents just need to go to someone and they'll do that. And that's not necessarily true. Parents have to understand that there's a difference between diagnosis and eligibility, and the school district has a process that they can bring that diagnosis to the school district, and the school district then has an obligation to review that evaluation and to determine whether they will complete a comprehensive evaluation. And if parents suspect that their child has a disability, they need to put that in writing to the school district.
Okay, thank you. As sort of a follow-up, you also mentioned that clinicians and providers are often uninformed, and you had your material there to help pediatricians, but what else can be done to help clinicians and providers to be more informed?
I think, attending trainings, calling in FAU, we can do an observation of a child. We can provide supports and resources to families and to the educators. I think there's this perception, families shared with me during this process that many educators said, oh, you don't want your child labeled autism. So there's this negative perspective about autism. So I think, unless the child is properly identified, they're not going to receive the proper intervention. And that's critically important. We've known that for some time in the field.
Yeah. Another question regarding special focus groups or affinity groups. Why do Hispanic children tend to be diagnosed later on in life? Is that a cultural factor? Are those cultural factors that play into that? Or do you know what the reason for that is?
Well, I think, it becomes even more complicated because when you look at disproportionality and actually through research projects and really bringing this out, the disproportionality in identification between white and Black has closed a little bit, but the variance between for Hispanics and also for females has not. And so I think through awareness, we need to increase that and ensuring that that children get properly identified. I think the language factors are key pieces. Yeah. The cultural pieces impact. I think, immigration probably to some degree impacts families as well, that they might be fearful that if they're not here legally. So all of those things that can really complicate the issue. Sure. And for females, what we see is typically they're not identified till relationships and the language becomes more complex. Usually about 8 or 10 years old, they engage in what we call masking and hiding those pieces, and they manifest differently as well. So I think, it's very complicated. I think we have an obligation to look at all of these pieces and ensure children are properly identified and receive proper intervention. Mm-hmm.
Sure. Is there a difference in the awareness of the parents, of the Hispanic parents, on what it means to be autistic?
I believe so. I think that due to cultural and within the Hispanic community, there are very wide differences culturally, the Cuban community, the Colombian community, there are different differences. And I think all of those, but the language piece is something that we felt at CARD, that making sure we had a clinician that speaks Spanish and that, there are Spanish support groups, and there are about 50 parents that attend those groups on a regular basis. We're just now, we were just able to hire someone that speaks Haitian Creole and starting to do outreach and making sure all of our materials and trainings are in Creole. That's really important. I read a statistic that in Palm Beach County alone, 93,000 Haitian Creole community members reside.
Yep. Yes, definitely. Okay, switching the topic a little bit here. This is a very specific question. We have an attendee participant who is leading an art program at a local museum for anyone on the spectrum, and they opened the class to have a family and caregiver attend. So they have 2 sessions, one for adult and one for the youth. The question here is if you can recommend any further training for their staff to improve the experience in this program.
Yeah, if they reach out to me, I'd be happy to connect them. We have done training in the past with the Boca Museum. I remember several years back, we do training with the faith-based community. So any community agencies. We also have a program called Autism Friendly Business, where the business receives training from the customer-friendly perspective first on how to be customer-friendly to families with autism, and then from there, how to support individuals that might happen to be an employee with autism. So that's another program that we have that helps supports families and individuals.
Wonderful, Maryellen. Coming back to the differences in identifying and treating children, Do you know how those differences influence the care for these individuals as adults?
Well, the research shows that, early intervention and appropriate evidence-based, and also the latest research in the last probably 10 years really talks about the parent implemented naturalistic interventions, where the parent is a part of the intervention process, is the most effective, because it not only it helps. Parents are lifelong educators for their children, so it helps the parent develop a relationship with that child, be able to deal with the child behaviorally, and empowers them and gives them confidence to be able to work with their child and help them to be hopeful through this process. It's a marathon, it's not a sprint. Raising children can be challenging, but raising a child with autism is particularly challenging because of the behavioral concerns, the language concerns, and manifesting what we see in upper elementary, middle, high school, and adults. We have a task force that deals with autism and mental health right now because of the concerns about anxiety, the high rate of anxiety and depression. About 70% of adolescents, young adults have experienced anxiety and depression, and that have autism.
Interesting. Okay, we are at the end of our questions. Now, CARD is located in Jupiter for any of those who would like to contact Maryellen.
We have actually 3 offices. We have one, we serve 5 counties. So we have an office on the FAU Boca campus, in the College of Education on the 4th floor. We have an office in the Jupiter campus in the SR building. And then we also serve the Treasure Coast. So we have an office at Indian River State College, Pruitt campus.
Great. So if you or anyone you know is interested in getting in touch with CARD, utilizing their resources, of course, most of them are online, but if you would like any additional information, please feel free to contact Maryellen. As I mentioned, we will be posting this the recording of this presentation on our website, so you get all of the information again there. Thank you very much, Maryellen. Thank you, everybody, for calling in. We'll see you soon. Thanks again. Have a great rest of your day.
Thank you.